All right, to expand this a bit more further, we're now joined by Doctor Mvuyisi Mzukwa. Dr. Mvuyisi, I'm sure you heard there the Premier of Limpopo, Popi Ramathuba, of course, calling on professionals specifically in the healthcare sector and education sector to report cases of this nature. Let's start off with your response. What is your reaction to the sentiments shared by the Premier of Limpopo?
Good evening to you, Mbali, and to your crew and your viewers, and compliments of the season. Mbali, we are saddened by, as the South African Medical Association, by the scourge of teenage pregnancy, but also, the killing of children, as you've seen with the tech shop saga. We are saddened by the state of affairs. And I think, as I listen to the Premier of Limpopo, I think, this is a very complex matter that cannot be just simplified, in a statement like that. But I think the Premier has jumped to Section 110 of the Constitution and has forgotten Section 28 of the Bill of Rights entitled children, to what should happen to children. One, it says, I will just read a bit of it. It says every child has a right to name and nationality from birth, family care, parental care, and to appropriate alternative care when removed from the family environment. But it then says basic nutrition, shelter, basic healthcare services, and social services be protected from maltreatment, neglect, abuse, or degradation. Now, these are issues that should be done by government. These are government, the reporting, Bali, is the after effect. We should not be reporting in the first place because government have protected these children, from abuse and from all the things that are happening. So before we go to Section 110, she needed to be honest about Section 28 to say what role has government played around the protection of children from abuse and from all these things. As stated in the Constitution, it's a constitutional right of children in the country.
And doctor, when it comes to patient and doctor confidentiality, where does this all play a role, particularly when you're dealing with children?
Well, I think our role is to report, regardless of what the case is, because there are many nuances around who should be held liable and stuff like that. But we are not involved. We are not investigating. We're not NPA. All we are doing is just to report. And from where I stand, I know that many healthcare workers are doing that. It's just that you can't blame the healthcare workers when there is no follow-up from the justice system. So, and also knowing that, some of these professionals are working under strenuous conditions, but they've been doing their work. So I think it's just cheap politics, to take the blame and put it to professionals when government has failed dismally. We've had children that were killed, about 22 of them in this country around the poisoning in the tech shops. And also you recall that there was this Enyobeni Tavern saga where 21 children were killed. And it was under this government. So it can't be, the killing of children and the rape of children can't be blamed on healthcare professionals. Reporting is not protecting them. Government should be protecting them.
So are you basically saying that, these sentiments coming out from the Premier of Limpopo is really not fair to professionals as they're trying to do their jobs?
It is very unfair to the professionals who are working hard in the state. I think it's I call it a Christmas excitement from the Premier of Limpopo. Because, if you look at what he's saying, like I said, quoting it to you now, she forgot her role as the Premier. She blames everybody else but, healthcare professionals. And she absolved government from, their responsibility to making sure that children of this country are protected, are not dying, like flies, like we see happening these days. So we are calling upon the Premier to say this is a complex matter. You can't simplify it by making unfortunate statements and cheap politics in the media without addressing the need. I'm telling you, children of this country don't care about the blame game that we see between politicians and professionals. They want to be protected. They want their rights as children to be upheld.
And Dr. Mvuyisi, you're also saying that, some professionals are actually, reporting some of these matters taking place in hospitals and in clinics. Are we aware of how many have been reported by healthcare professionals?
Well, we do not have that statistic, Mbali, but we do know that our professionals are reporting this. I mean, I worked in the state as well. I had encountered such challenges as well. And I know what we used to do, reporting this to sometimes we even call police, to come to casualty. So to get excited and say that professionals are not reporting, I think it's very, very unfortunate.
What is also the danger, when it comes to saying that healthcare professionals, nurses and doctors should also be reporting, such cases? Does this also not deter younger or teenagers from actually getting the necessary help and the necessary medical care, because some would be afraid to go to a clinic because they would be afraid that people would get arrested?
Yes, you are quite correct, Mbali. And that's my statement in the beginning, to say this is very complex. You can't just make a silly statement like that one. You do need to consider the fact that it is intimidating, to those children, those teenagers, to come to our healthcare facilities if they know that there's a possibility of people being arrested, and also there implications to what has happened to them. So like you heard from the MEC in KwaZulu-Natal, she really realized that there is a serious problem if we use that approach bluntly. We do need to be strategic. We do need to engage all the stakeholders so that this matter is handled as in a holistic manner, not just a blame game that we are seeing at the moment.
And lastly, before I let you go, do you think a broader conversation needs to be held with the various stakeholders so that we don't see professionals, speaking at each other in this way, where some are going to the media to come and address some of these issues? Do you think that it's very necessary for all professionals to come together and to decide on a way forward of how to treat such cases? Because it is happening.
Yes, Mbali, you're quite correct. And like I said, it's a multidisciplinary approach because if you look at it, there's justice system involved, there's social workers involved, there's healthcare involved, there's government involved, in terms of national policies and what should be done. So I do think that it's too late, or people have delayed this approach. We should have done it long time ago. It's overdue. So I think we instead of attacking each other, we should be calling it all of us under one roof and come up with strategies on how do we approach this serious matter that is killing our nation, killing our children, and destroying the future of our children, and I think government should be taking a lead in that regard.
All right, Dr. Mvuyisi, thank you so much for your time and for your contribution. That is Dr. Mvuyisi Mzukwa from the South African Medical Association, saying that, a broader conversation needs to be held in that regard to deal with this matter with the seriousness that it needs. Of course, talking to us there about the sentiments coming out from Popi Ramathuba, the Premier of Limpopo.